Hi everyone. Today in this video let's talk about side effects of gabapentin. Gabapentin is a well-known drug with its brand name Neurontin. This is one of the medications that belongs to the anti-epileptic drugs. But what are the important side effects of this medication and what is its effect on different organs and how it produces side effects, how it interacts with other drugs? All these things we will discuss in this video. Before going to see the important side effects of this medication, let us see the clinical use of this drug. Gabapentin is an anti-epileptic drug, so it can be used in the treatment of partial onset seizures. At the same time, this medication can also be used for other conditions like neuropathic pain. And even it can be used to control the pain in post-herpetic neuralgia. Finally, this drug can also be indicated for the treatment of restless leg syndrome, RLS. In this way, gabapentin mainly inhibits the neuronal activity, so it can be used as analgesic, or it can be used as anti-epileptic, or it can reduce the excitation. Whatever may be the use, this is one of the widely used medication. So it is very essential to know the important side effects and how they should be managed. So let's start our discussion with the different side effects of gabapentin. First one is breathing problem. Gabapentin mainly acts on the CNS, so it acts as CNS depressant. It is not having direct effect on lungs, but when this gabapentin is combined with other CNS depressants like opioids, it can produce some respiratory depression. Because opioids can directly produce respiratory depression, when they are combined with gabapentin, this combination can produce some severe respiratory depression. Many of the times, opioids may be combined with anti-epileptic agents to control the pain. For instance, morphine is one of the drugs which can be used as opioid analgesic. So when this morphine is combined with gabapentin, it can produce respiratory depression. So even gabapentin is not directly producing breathing problem, it can produce respiratory depression when it is combined with opioids. Not only opioids, we have the other drugs like anti-anxiety drugs, like benzodiazepines, or antihistamines. All these drugs can produce respiratory depression when they are combined with gabapentin. So these drugs should be carefully used. And if you observe any few of the symptoms like shortness of breath, trouble breathing, breathlessness, in such conditions use of gabapentin should be carefully monitored because these symptoms indicate some respiratory depression. Particularly respiratory depression is more pronounced in the people with any previous history of respiratory disorders. So in the people with COPD, chronic obstructive pulmonary disorder, gabapentin can increase the respiratory risk. Even the side effect is more pronounced in the elderly, so in the elder people, gabapentin should be carefully used. Second side effect is a central depression. Since gabapentin is a CNS depressant, it can produce a variety of symptoms, can increase the dizziness, and it can increase the sleepiness and drowsiness in the people. Even it can increase the tiredness, and unexpected weakness can be observed. With use of gabapentin, people may have few of the speech problems and they may find some difficulty with speech. These side effects are common with many of the anti-epileptic drugs which produce CNS depression. And when this gabapentin is combined with alcohol, these central side effects are more pronounced. That's why it is recommended that high intake of alcohol should be avoided with gabapentin. Similarly, many of the CNS depressants just we have discussed like sleeping pills, anti-anxiety medication, they should be carefully used with gabapentin. Along with the dizziness and drowsiness, gabapentin can also produce blurred vision, double vision, which may impair the visual activity. So care should be taken while driving the vehicles or working with machinery because gabapentin can impair the concentration in the people. Third one is gastric effects. Use of gabapentin can produce few of the gastric effects like diarrhea, but sometimes it can also produce some constipation. In few of the people, diarrhea can be observed, but in few of the people, constipation can also be observed. But in most of the people, diarrhea can be observed as one of the important side effects of gabapentin. It can also produce some dry mouth and nausea and vomiting. So with use of gabapentin, few of the essential body fluids are lost either by diarrhea or by nausea and vomiting. So whenever oral contraceptives are used along with gabapentin, they may be lost out of the body due to either diarrhea and nausea and vomiting, which results in their loss of contraceptive action. So if you observe diarrhea or vomiting with gabapentin, oral contraceptive should be carefully used. Fourth one, dehydration. Dehydration is another effect of gabapentin which can be clearly observed as dark stools, smelly stools can be observed. This is because of loss of body fluids due to dehydration. In few of the people, this dehydration may be combined with diarrhea. In such conditions, plenty of fluids and water should be taken to restore the body fluids. Fifth one, changes in memory. We know that gabapentin acts on the brain and it depresses the central nervous system, thereby it can impair the memory. So gabapentin can produce amnesia, a temporary loss of memory, which can be clearly observed within first few weeks of the treatment. Sixth one is the weight gain. This is another important side effect of gabapentin. This medication can increase the appetite in the people, so it can increase the food intake which may result in the weight gain. That's why while using gabapentin, you should take a balanced diet and you should avoid high calorie diet and fatty foods in order to control the weight gain. Seventh one, mood changes. This is particularly observed in the children with 3 to 12 years of age. In those people, use of gabapentin can produce variety of mood changes resulting in hyperactivity, thought disorders, aggressiveness, and even suicidal thoughts can be produced by use of gabapentin. So in such age group of people, gabapentin should be carefully used and any abnormal change in the mood should be thoroughly monitored. Eighth one, motor effects. Gabapentin can produce some motor side effects. One of the important one is the ataxia. Motor incoordination can be observed, which may result in some jerky movements and even it can produce some loss of balance. In few of the people, gabapentin can also produce some tremor and shakiness. Ninth one is the addiction symptoms. Gabapentin is one of the addictive drug, so it should not be stopped suddenly. Instead, it should be slowly tapered in order to avoid any withdrawal side effects. So even with these precautions, if you observe any withdrawal symptoms like increased anxiety, insomnia, lack of sleep, excessive sweating, palpitations, excessive heartbeat, if these symptoms are observed, it may indicate some addiction with gabapentin. Then you should discuss with your physician in order to control these withdrawal symptoms. That's why high dose of gabapentin should be avoided, and even the dose of the gabapentin should not be suddenly stopped in order to avoid withdrawal effects. 10th one, effect of antacids. Antacids can interfere with gabapentin, so when they are combined with this medication, they can reduce their absorption. Particularly antacids are containing aluminum and magnesium salts, which may form a complex with gabapentin and thereby they can reduce its absorption. That's why antacid should not be combined with gabapentin, and if it is required, gabapentin can be taken after 2 hours of administration of antacids. So these are the various important side effects as well as precautions of gabapentin. The main side effect of this medication is the CNS depression, which results in drowsiness and sleepiness, which is further enhanced by other CNS depressants and alcohol. Even this medication can produce breathing problem when it is combined with drugs like opioids, antihistamines and other CNS depressants. Weight gain, blurred vision, mood changes, temporary loss of memory and blurred vision are the few of the other important side effects of gabapentin. But many of the side effects are well tolerated and drowsiness is the common side effect that can be observed in most of the people. So that's all about the important side effects of this medication gabapentin. If you observe any other side effects of gabapentin, post them in the comment box. So that's for today. Hope you have enjoyed this video. If you like this video, please subscribe to our channel, share this video with your friends. Thank you for watching this video.